being pregnant in the time of COVID has turned their lives upside down. It's piled on a lot of additional stress and anxiety.
The isolation and also that fear of accessing healthcare.
Thinking about all the risk factors to have my child in a hospital setting.
I felt like that was my only option.
Before COVID, we were getting calls like 10 a week. And at the height of the pandemic, we were getting 200 calls. We were not able to handle it.
With COVID, there was some temporary relaxation of some of the regulations around opening new space for healthcare facilities. We were open by early June. So we're in one of our birth suites at Jazz right now, and once families come in, this is where they spend the entire time, so labor, birth, and the postpartum period until they go home. I got a call from Every Mother Counts, which has provided some financial support to get this birth center off the ground. Brooklyn Birthing Center is the only birth center in the 5 boroughs that's both licensed and accredited. As a license holder, they were able to expand their footprint with accelerated approval processes. A tub for labor is an amazing way to provide relaxation, pain relief. The governor of New York declared that people who hold licenses in other states could practice medicine, nursing, midwifery on their out-of-state license in New York. So that enabled us to quickly get staff from other places who worked in or even operated other birth centers.
Probably about this big, and your baby's about this big, so it could swim all over the place in there.
Amy's post said, hey, we've got this amazing project in Manhattan. We're opening a COVID response birth center. Anybody want to come join us? So I contacted Amy on a Wednesday. 13 days later, on a Tuesday, I was in New York City, and I got to catch 2 babies on Friday. There's a whole floor of rooms that are still set up as a hostel. Myself and some of the midwives who are traveling here to help are able to use the rooms upstairs to stay in while we're here.
This neighborhood and this space has history around Jazz. The reason it's called Jazz is it used to be the Jazz Hostel. The sense of independence and strong female musicians is sort of embedded in this place of trying to do things a little differently and with strength and empowerment and creativity at the core.
When I started the Brooklyn Birthing Center, it took me 7 years to get it done. We didn't know what the requirements were. Everybody was learning during the process. At the time I started the birthing center, I was also doing obstetrics. I was delivering babies. I was very busy. The system at the hospital just frustrated me so much. One Friday morning at a conference, I looked at my 2 colleagues, one on each side, and I said, if I open a birth center, will you bring patients to the birth center? And they both looked at me and said, you got to be really crazy. And I guess that was a challenge. I have to prove to them that I'm really crazy. We had a very ambitious plan. We wanted a big birth center, only to realize that we couldn't afford it. And finally decided, I said, okay, we'll just use the first floor of my house because I don't have to pay rent to anybody. It's been there 21 years. We plan to move soon.
At first, I was a little bit skeptical about coming to the birthing center, but then once I finally came to the first appointment, I felt great. You know, everybody here is very, very warm and kind and helpful. I had to sort of break out of the shell of thinking that hospitals was the only way to give birth. This feels much better for me.
Honestly, I think most people have never heard of a birth center. There also is an assumption that it's just like a nice room with curtains and some midwives caring for you, but we actually are a medical facility equipped for a broad range of common issues that come up in birth, but it's also equipped to really empower people to give birth on their own terms with confidence and with their sort of own strength and capacity rather than, doing things to you as a patient. I've had 2 natural births. It's an amazing experience. It's the best high you'll ever have is the high of having just done that. And you truly finish giving birth naturally and think to yourself, I could do anything.
So the birthing center ended up being the great, what I call a middle ground option, where I felt we had the best of Western medicine, but I also felt like I had the power of doing whatever I felt my body wanted to do. They had all the plans. If something is an emergency, a true emergency, you start from like, this is a natural thing, it's normal. And you just have all these other steps to escalate if needed.
Our bodies are really made for physiologic birth, except when complications during the pregnancy occur.
It's not just not doing things, it's actively supporting the normal progression of labor. The whole idea of labor is to help the baby find its way out and just make space for the baby. COVID has forced us all to really ask the question of why did we do things the way we did previously? There is a role for medicine and surgery in pregnancy, but planning a birth center birth is really putting into place a comprehensive plan to reduce your exposure to sort of unnecessary intervention.
We call it low intervention. We don't say no intervention. We intervene if necessary. Positions and exercises that will facilitate the descent of the baby's head. They are very, very professionals, the midwives, and I think some of the misconceptions is probably just from competition.
This scenario is going to start with a G1P0 with a normal labor course, who's been pushing for 2.5 hours.
It was labor. It was really difficult. It wasn't a stroll in the park, but we got to bond with the baby for 6 hours after the fact. He was sleeping with me in a big bed. There were no beeping, no nurses coming in, turning the light on. They let you just feel your body and just do you. And I felt everybody was there supporting me. And it was up to me to do this together with everybody.
I need to repeat it this way. Deep breath and push.
So I hope that through the experience of COVID and all the changes that have been made, that people realize some women are definitely safer in the hospital, but for a good portion of women, not being in the hospital can actually be safer, can lead to better outcomes for the woman, better outcomes for the baby, not just a warm, fuzzy candlelight experience, but actual safety can be improved.
With shoulder dystocia, 1 maneuver, 2 maneuver, 3 maneuver, call.
So we did a shoulder together last week, and I thought it went extremely well.
I'd like to really see a birthing center in every community, especially where we have so much healthcare inequity. And I think that's where we could say we made a difference. 54% of our patients are on Medicaid. No other birthing center can claim that.
It's important to me that people have choices about their pregnancy and birth. This is a meaningful life event, and this is a family growing. And so, yes, there are medical things that we need to attend to, but it needs to also be an experience that fosters healthy family adaptation.
What I want women to know is that you're in control of how you want your pregnancy to be. Do your research, do what you feel comfortable with.
Ask around, and there are options out there. You just really need to find whatever works for you.
It's a mission for me. I am known for some things. I do good surgery and I bake good cheesecake. But I like to be remembered for my birthing center idea.
My name is Amy Romano.
My name is Dr. V, and I'm a scary mommy.
And I'm a scary mommy.
Big changes are coming.